In Boston, as of today, 355 new confirmed cases. That's a total of 23,196. There's no new deaths, bringing our total to 884 deaths. Our prayers are with the families who are sick and suffering with COVID-19 and those families who have lost loved ones. I'm going to address a little bit in a few minutes about the number of cases today. Today is the largest case number I think we've seen since maybe June in the city of Boston, 355 cases. For the testing data for the week ending November 6th, Friday, November 6th, the average of 2,500 Bostonians got tested each day. That was a really big increase compared to the 1,780 from the week before. The Get the Test Boston campaign is having an impact, and I want to thank all the folks who are getting tested. I also want to thank the media who helped us promote getting tested a couple weeks ago. It's been beneficial. It means that we're going to be able to respond more accurately and effectively to where the virus is spreading and certainly how it is spreading. At the same time, we also saw more positive cases here. Our daily new cases went up to 180, and last week we're at 128 cases per day. So we're seeing a pretty significant increase in daily cases. The result of our positive test rate remained at 7.2%, the same as the previous 7 days. So the positive rate will stay the same because we're doing more testing, but we're looking at the number of new cases per day. The neighborhoods with the highest positive rates in the city remain Dorchester, Mattapan, and East Boston. Roxbury and Rosendale also went up over 10% last week. And East Boston is still a major concern now. The rate has jumped to over 16% of the people testing positive in East Boston are testing positive for COVID-19. We still have a lot of work to do, and we're focused on getting the most comprehensive data so we can see a full picture. The epidemic is evolving, and its impact on our neighborhoods also evolve. We need to evolve, and what we're doing is monitoring so we understand the complexities of the COVID-19 spread in our communities. For the last few weeks, our public health experts have been digging deep into the data, and they'll be developing additional metrics, which we'll be able to share more about next week. And we're looking at the metrics so we can get somewhat of I guess, a more accurate number for Boston, what a Boston rate would look like. But that's going to be with increased testing and other ways of looking at it, including hospitalization. In the meantime, you can help strengthen our data and protect your family by getting tested. We have over 30 testing sites here in the city, and we have we're operating 2 mobile testing sites that are free and open to anyone regardless of symptoms. This week through Saturday, they're in East Boston at Central Square Park, and they're in Mattapan at Jubilee Christian Church on Blue Hill Avenue. And just to call ahead, we're asking people to call ahead to pre-register. Those numbers and information about all of our testing sites, you can either go to the website at boston.gov/coronavirus or just simply by calling 311 here at City Hall. We saw gatherings last week and over the weekend in here in the city. They were peaceful and positive demonstrations and celebrations right here at City Hall Plaza. We had one. The vast majority of people were wearing masks. We just wanted to monitor the crowd to make sure everyone was having masks on. I want to thank all the people. I want to thank the police department, first responders for ensuring that everyone had a safe experience. But we also want to just remind people, if you're gathering groups like you did over the weekend and last week after the election, we're asking you should probably get tested. It'll probably be helpful to you and your family just to get a test, just to make sure that you're okay. And please, every day, whatever you're doing, we want people to continue to be vigilant, be safe, and help us stop the spread of the virus. We are at another critical point. Last time I said something like that was probably back in May, but we're at a critical point right now here in Boston and Massachusetts. We need to continue to work together. We're asking people to wear face coverings while they're outside their home. We're asking, regardless of anyone around you or not, we're asking you to wear a face mask outside your home. We're asking people to continue to remind them to wash their hands with soap and warm water and continue to wipe down surfaces that are frequently touched. We're asking people to avoid gatherings, especially parties. We're asking you don't host gatherings and don't attend gatherings. That's something that we're seeing. I was talking to a buddy of mine today, and he was telling me that there was a gathering somewhere, a bunch of people were there, and 5 or 6 of the people that were there got COVID-19. So it really is, it spreads it. And you would think it's innocent, but it might appear innocent, but if they're not family members, you don't know who other people are in contact with. So you want to keep yourself safe, and you want to obviously keep your family safe. We also were, the new state advisory went into place. We're asking people to stay home between 10 p.m. and 5 a.m. unless you have to go to work or run for essential items, errands for essential items. If you operate a business, we're asking you to follow the safety guidelines and the new closing time of 9:30 for in-person dining and other activities. And I know there's some pushback on that, and businesses are upset about the 10 o'clock closing. But again, when you have 300 plus cases in one day in Boston, and we haven't seen those numbers since the beginning of the virus when everything was shut down, we don't want to go back to that place. So we're asking people to please pay attention to the suggested recommendations. For any information people are looking for on reopening or on the virus right now, you go to boston.gov/reopening. Again, you can call 311.